Fresenius Medical Care is the world's largest integrated provider of products and services for people affected by chronic kidney failure. As a worldwide leader, we are committed to raising the standards of peritoneal dialysis by continuing to develop innovative dialysis products that improve the quality and convenience of this therapy. This training video is provided to give you information on how to use the Stay Safe CAPD system. Your physician and the nurses at your dialysis clinic will tell you more about how to handle the Stay Safe system and the day-to-day steps necessary to perform your PD treatment safely and effectively. This video is designed to be used in conjunction with personalized instruction from a trained professional. It should not be your only source of training information. Before we demonstrate the Stay Safe system, let's be sure that we have our dialysis terms clearly defined. Dialysis is a process that takes the waste products and excess fluids out of your body by removing them from your blood. Peritoneal dialysis is a process that uses the inner lining of your abdomen, called the peritoneum, as a natural filter to remove the waste and excess fluids from your blood. This is done by filling your peritoneal cavity with a special fluid called dialysate. The dialysate stays or dwells in your abdomen for an amount of time prescribed by your physician. It is during this time that the waste products filter through your peritoneum into the dialysate fluid. At the end of the prescribed time, the fluid is drained back out. This process of filling the peritoneum, allowing the dialysate to dwell, and then draining the peritoneum is called a peritoneal dialysis exchange. Peritoneal dialysis can be performed manually through a process called CAPD or with the use of a machine referred to as a cycler in a process called APD or CCPD. Today we'll be showing you how to do a CAPD exchange using the Fresenius Stay Safe system. Before you start the exchange procedure, you must prepare your work area. To prepare the work surface and reduce the chance of contamination, clean the area with disinfectant. Then put all the Stay Safe equipment on the table. You will need a mask, your peritoneal dialysis solution warmed, a Stay Safe cap, and your Stay Safe organizer. You may also use a waterless hand disinfectant if instructed to do so by your facility. The best way to warm a solution bag is dry heat, such as a heating pad. You will be provided one with your dialysis supplies. Your PD nurse will instruct you on how to accomplish this in the safest and most effective way. Position your organizer at the edge of your work surface, or place it in a holder on the IV pole. Remove your extension set from your clothing and close the clamp on the set. Before you start the exchange procedure, you should mask and wash your hands thoroughly with antibacterial soap for at least 1 minute, or as directed by your clinic. First, take off your jewelry and wristwatch. Lather your hands with the running tap water and soap. Make sure you also clean between your fingers, and don't forget your wrists. Wipe your hands dry with paper towels and turn off the tap using the used paper towel to prevent your hands from becoming contaminated. Open the outer wrap of your solution bag by tearing down from a notched edge. If you see moisture on the outside of the bag, you may wipe it off with a paper towel. This type of condensation is a normal occurrence. Gently squeeze your solution bag to check for leaks. Sometimes bags become damaged during transport or storage. Never use a bag that has a leak. Check your bag to see that the solution is clear and that the bag size is correct. Make sure that you have the correct dextrose concentration and that the expiration date has not passed. Next, locate the Stay Safe disc with a plastic cover. The cover is color-coded to match the dextrose concentration of the solution. Turn the blue dial on the disc counterclockwise until it fits into the cutout portion of the plastic cover. You will be able to remove the plastic cover after the dial is in the cutout. The dial will be in position 1 on the disc. Place the disc into the organizer. Press the tubing into the channels on the organizer. Hang the solution bag on the IV pole and place the drain bag on the floor. Break the cone in the outlet port of the solution bag. Bend the port back and forth a few times to ensure a complete break. Remove the Stay Safe cap from its package and insert it into one of the 2 notches on the organizer. Place the end of your extension set into the other organizer notch. If instructed to do so by your facility, disinfect your hands with an appropriate hand disinfectant. Wait until your hands are dry before continuing with the exchange. Unscrew the protective cap from the Stay Safe disc and discard it. Unscrew your extension set from its Stay Safe cap and immediately connect it to the disc. The pin from the extension set will remain in the used Stay Safe cap. Leave the cap in the organizer. Open the clamp on your extension set. The blue dial is already at position 1, the drain position, and you will start to drain as soon as the clamp is opened. If you wish, you may now remove your mask. The outflow procedure starts. The drain should take about 20 to 30 minutes. After the solution is all drained from the peritoneum, turn the blue dial on the disc clockwise to position 2, the flush position. The flush process sends some fluid from the new solution bag to the drainage bag. This will remove air from the fill line. Make sure the line from the solution bag to the disc fills completely. After a few seconds, turn the dial clockwise to position 3, fill. The fluid from the new PD bag will start to fill your peritoneum. Please be certain that the dial is in the full flow position to maximize flow. You will reach the full flow position by turning the dial to the solid circle pictured on the disc. The fill normally takes 10 to 15 minutes. When your fill is complete, turn the blue dial clockwise to the very end of position 4, close. You will feel a click when you get to the last position. This will insert the pin from the disc into the end of the extension set. Close the clamp on the catheter extension. Then, clean your hands with a hand disinfectant if instructed to do so by your facility. Wait until your hands are dry before continuing with the procedure. Unscrew the protective cover from the new Stay Safe cap. Unscrew your extension set from the disc. The closure pin will be visible at the end of your extension set. Make sure the new pin remains firmly in place. Immediately connect your extension set to the new Stay Safe cap. Then, remove your capped extension set from the organizer and secure it to your abdomen. To close the system and prevent drips, place the protective cover from your new Stay Safe cap on the used cap that is still in the organizer. Then, remove the cap from the organizer, turn it around, and connect the open end of the protective cover to the disc. Before discarding the used solution and tubing, check the drain dialysate. If the drainage is cloudy, please contact your dialysis center immediately and keep the drain fluid for analysis. Then remove the whole Stay Safe system from the IV pole and organizer and discard the solution as directed by your dialysis center. With this, your exchange is complete. Please follow this procedure for the number of exchanges prescribed by your physician. We hope that you have found this presentation informative and helpful.